as straight and tall as possible with his back to the wall. Make sure that his head is midline, sight line is parallel to the floor, shoulder, buttocks, and heels touch the wall, and medial malleoli are together, if possible. Slide the measuring rod down until it rests on the top of the child's head. Then check his height measurement.
You've grown a lot since last time you were here.
For a child younger than age 18 months, measure length instead of height. To do this, place him supine on a paper-covered surface. Mark the top of his head and, with his legs extended, the bottom of his heels. Then measure the distance between the marks. Allow an older child to wear underpants or a light gown. Instruct him to stand on a regular platform scale. Then check his weight. To assess head circumference for a child younger than age 2, measure it at the greatest circumference, as you would for an infant. After obtaining vital signs and measurements, thank the child for his cooperation and give him a small reward, such as the outline or a sticker.
Okay, a very good visit today, and you're really growing and making good progress. Kendall has gotten so big since the last time I saw her.
She has.
Yes, she has. Today, we're going to test her vision.
To test visual and hearing acuity, position the child appropriately. For example, keep an infant or toddler on her parent's lap. Then adjust your technique to her age.
So Kendall is doing just fine, and what we want to do at this point is to see how her eyes react to the light.
For an infant, use clinical tests, such as darkening the room and shining a light in her eyes. Her pupils should constrict, and she should blink, become more alert, or show other reactions.
Okay, let's do it once more.
Also, move a brightly colored object in front of her. An infant older than age 3 months should follow it with her eyes.
Joey, I'm going to have your mother cover your right eye, and we're going to play a game. You're going to tell me what you see on these cards.
To test a toddler using Allen cards, first make sure that he recognizes the pictures.
You know what that is.
Then ask him to cover one eye, or have his parents do this, and give him instructions.
I want to open.
Good.
If the child misidentifies a picture, try a different picture at the same distance.
What do you see?
Then repeat the test with the opposite eye covered.
And over his right eye.
There.
All right.
To express visual acuity, use the farthest distance at which the toddler identifies the picture as the numerator. Use 30 as the denominator.
Good. Carson, would you like to play a game? Hold this card on your lap. Now for this eye test game, you have to cover one eye at a time. Would you like to use your hand or a pirate eye patch?
Pirate eye patch.
Okay. Now Carson, when I point to a letter, you show me on your card what the letter is.
To test a preschool child using an HOTV chart, seat him 10 feet away and place an HOTV card on his lap. Have the child cover one eye or ask his parent to do this. After providing instructions, point to letters on the HOTV chart and have the child point to the matching letters on his card. With the child's opposite eye covered, repeat the test, noting the smallest line he can read accurately.
Carson, these E's look like the legs on a table, and I want you to use your thumb to show me which way the legs are pointing. Okay, here we go.
As an alternative for a preschooler, use the tumbling E chart. Take a similar approach to the HOTV chart, but have the child point in the direction that the E is facing.
Now, Madeline, we're going to go into this room and check your vision. There's going to be a line on the floor that I need you to put your heels on. So come on in.
To test a school-age or older child, use a Snellen letter chart.
Madeline, take this and cover your left eye.
If she wears glasses, have her keep them on for this test.
Now, Madeline, I want you to tell me what letters you can read on this line.
Next, ask her to read the bottom line. If she can't read 4 out of 6 letters on that line, move up to the next line and the next until she can read at least 4 out of 6 letters.
Let's try the next line.
T-C-E-O.
That's very good. Let me write that down.
Note the smallest line she can read accurately, and repeat the procedure on the right eye. To test hearing acuity, also adjust your technique to the child's age.
Now we're going to test her hearing.
Use clinical tests on an infant. For an older infant, step out of her field of vision and make a familiar sound, or have her parent call her name.
Very good, Kendall.
The infant should turn toward the sound to try to locate it. For more accurate testing, ensure that an auditory brainstem response or evoked otoacoustic emissions test is performed before discharge from the birth hospital.
Okay, now, Carson, we're going to see how well you can hear. I'm going to be making some sounds, some notes through these headphones, and I want you to raise your hand each time you hear one on the side where you heard it. Okay, you understand?
To test a preschool or older child, use audiometry. In a soundproof area, explain what to do. After placing headphones on him, perform the threshold acuity test by transmitting a sound at a level the child can easily hear. Slowly reduce the volume until he can no longer hear it. Repeat this for a range of frequencies. Also perform a sweep check by transmitting different frequencies at 20 or 25 decibels. The child should be able to hear all frequencies. After testing visual and hearing acuity, review your findings with the child and parent. If you found a deficit, notify the physician and provide a referral for additional assessment. To assess for pain in an infant, observe her environment and gently remove any coverings. Then observe for behavioral responses to pain. Assess the quality, timing, and duration of the infant's vocalizations. Notice crying that's louder, higher, harsher, longer, and more tense than usual, as well as any groaning, whimpering, or grunting. Observe the infant's facial expression for signs of pain. Watch for expressions such as frowning, grimacing, flinching, or furrowed brows with tightly closed eyes, raised cheeks and a broadened nose, an open, squarish mouth, and a quivering chin. Next, characterize the infant's body movements and posture. In a young infant, expect to see a total body response with rigidity, tremors, or thrashing, and possibly local reflex withdrawal of the painful area. In an older infant, anticipate a localized body response with guarding or withdrawal of the painful area and resistance to a stimulus, such as pushing it away. Also evaluate the infant's sleeping, eating, and activity patterns. Be alert for changes in the sleep-wake cycle, feeding behavior, and activity level, and watch for fussiness and irritability. Next, check for physiologic responses to pain. Assess the color and character of the infant's skin. Note any signs of pain, such as pallor, flushing, mottling, sweaty palms, and cool, clammy skin. Observe for other physiologic signs of pain, such as dilated pupils, clenched fists, hypotonia and hypertonia. decreased level of consciousness, inconsolable crying, and inability to follow or focus on near objects. Check the infant's oxygenation and related pulse oximetry findings. If she's in pain, expect variations in oxygenation and respirations. Then check the vital signs. Be alert for an altered heart rate, rapid shallow respirations, and an increased blood pressure. Review the results of laboratory tests. Note pain-induced metabolic or endocrine changes, such as hyperglycemia and decreased pH. Finally, rate the infant's degree of pain using the pain assessment tool approved by your facility. To do this, score each behavioral, physiologic, or other factor based on the tool's scale. Total the scores for all factors, and compare the total with that tool's scoring range. For example, with the CRIES pain measurement tool, score 5 factors on a scale of 0 to 2. In this infant, rate crying as a 1, requires increased oxygen as a 0, increased vital signs as a 1, expression as a 1, and sleeplessness as a 1. Then total the score, which is 4, and compare it with the scorings range, which is 0 to 10, or no pain to the worst pain. After assessing the infant's pain, provide non-pharmacologic comfort measures, notify the physician, and prepare to administer an analgesic as ordered.
I hear you're feeling bad.
To assess a child's pain, prepare by gathering the necessary equipment and planning to follow the steps of the mnemonic quest. First, question the child to assess her current pain and learn about her pain history.
Did you tell anybody about it, like Mommy or Daddy? And what do they do to make the hurt go away?
Mommy puts a cool cloth on my head and she gives me ice cream and medicine.
What helps the most?
Mommy and ice cream.
Abby, I want you to choose the face that best describes your pain.
Next, use a pain rating scale, such as the FACES scale, and provide instructions to the child. Because many scales exist, choose the one that's best for the child's age and abilities. With an older child, for instance, you may use the adolescent and pediatric pain tool. Then evaluate for physiologic and behavioral changes caused by pain. Assess for physiologic changes, such as increased pulse, respirations, and blood pressure.